The tool we're going to be looking at is the CDC Wonder, which is two parts. The first part is the Wonder Systems online databases, which gives you AIDS, public use data, and cancer stats, which we'll be looking at. And there's also the second part under Topics, which I think of as the springboard to CDC's topic pages on disease and disability, different cancer data, diabetes, heart disease, health promotion, babies, behavior and health, etc. So let's get back over to Wonder Systems, because for AIDS public use data, you can narrow it down to county. So let's go to Data Request, and then you can group results by we're interested in location. And for our location, we want to look at Omaha. So I'm going to find Omaha, Nebraska, and I can select which years I'm interested from 1981 all the way to 2002. So I'll just have 2002 selected. You can select multiple years. And then if I'm also interested in including my age of diagnosis, country of birth, race or ethnicity, HIV exposure categories, any of these risk factors, you can include that data. When I'm ready, I'll select Send. And it gets processed, and all of my data shows up that there are 51 cases from 2002 in Omaha, Nebraska, which you can see right here. Okay, so that was the AIDS public use data. Let's go back, because there's one other tool, the cancer stats, which had some good data narrowed down by our specific location we're interested in. Now for this one, it's a little bit different. You'd want to choose MSA to get the metropolitan area we're interested in, or you can choose by state if you want to see Nebraska as a whole. But if you want Omaha specifically, we'll find Omaha, Council Bluffs area, so that metropolitan area. You can choose your cancer sites. If you want it to be grouped results by that, you can choose the age groups, if you want all ages, all ethnicities, a number of different criteria. And then when you're ready, you can select Send. It gets processed. Okay, and you can see the different cases here, organized by cancer site in the Omaha and Council Bluffs area. Okay, so good information on cancer stats, organized by location from the Cancer Stats database. Let's go back, because I want to show one more database under Topics. So this is the online databases that they have on these specific diseases or conditions. Now under Topics, they have a little bit more to work with, but it might not be the same kind of data. Like it might not be organized by county or by city, but just by state. But let's actually look at one that I know is organized by county specifically, and that one is going to be the Heart Disease and Stroke Atlas. Okay, so if you're interested specifically in heart disease and you want to look at Douglas County, we can select our state level to be Nebraska. Okay, so now we're looking at Nebraska as a state, and then we can select our heart disease and stroke data we're interested in. Let's actually do all stroke. And we want the number of deaths or the number of hospitalizations or the discharge status. We can also look at heart failure if you want that data, coronary heart disease. So there's a lot of different conditions here with different data sets they've collected. So we'll select death. And for filtering, I'm just going to leave it at all race and all gender. And my age group is 35 plus for the 2011-2013 years. Now we can show our map. And it gives you a legend with the different colors corresponding to the rates per 100,000. And you can mouse over. And here's Omaha, so you can select Omaha. Or actually, you can select Omaha and it will show up as Douglas. And then you can view the county report, where it gives you the stroke death rate per 100,000, 35 plus. We've included all races and all genders. But the nice thing about it is it will also drill it down a little bit more for you and give you specifically the rate among Black non-Hispanics or white or Hispanic. Looks like there might be some census data down here too with county demographics. Okay, so I'm going to close this. And let's go back out. So it was a quick overview on the different types of information you can find within the CDC Wonder, different databases that can narrow it down quite narrowly to the different counties that you're interested in. But I also encourage you to look at the topics because there's a lot of good information. If you're interested in diabetes, they have an interactive atlas, which is going to be similar to the heart disease atlas. So I would look at those topic pages and those atlases to get more information if you're interested in that. All right, thanks.